The female reproductive organs include the vagina, the cervix, the uterus, fallopian tubes, and the ovaries. Uterine fibroids are non-cancerous tumors in the uterus. Uterine fibroid begins with an abnormal growth of cells in the uterine wall. Uterine fibroids grow in place and don't spread or metastasize to other parts of the body. The four main types of uterine fibroids are intramural, which grow inside the wall of the uterus; subserosal, which grows on the outer wall of the uterus; submucosal, which grows in the inner wall of the uterus; and pendiculated, which grows on a small stalk attached to the inner or outer wall of the uterus. The signs and symptoms of fibroid tumors include heavy menstrual bleeding, irregular bleeding between periods, lower back pain, pain during sex, frequent urination, fullness and enlargements of the lower abdomen, and pregnancy complications, among other signs and symptoms as well. Uterine fibroid embolization is a minimally invasive procedure. UFE does not remove the uterus or the ovaries. Rather, a small incision is made in the leg to gain access into the femoral artery. A long flexible tube called a catheter is then inserted into the femoral artery. It is guided up the femoral artery and into the artery that supplies blood to the uterus called the uterine artery. The catheter is then guided to small arteries that supply blood to the fibroid. Uterine fibroid embolization delivers tiny microspheres or particles to the artery that supplies the fibroid, cutting off the blood flow, causing the fibroid to shrink. The tiny microspheres are injected through the catheter and travel through the blood vessel. Since the microspheres are more than 60 times larger than the red cells, they block the small vessels that the red blood cells travel through to reach the fibroid. The procedure is repeated on the uterine artery on the other side to make sure that all blood supply to the fibroid has been cut off. All fibroids are treated simultaneously. Once the blood supply to the fibroid has been blocked, the fibroid begins to shrink. There is no scar tissue and there is minimal blood loss with uterine fibroid embolization.